As we grow older, our bodies begin to change in ways we often do not notice at first. Muscles that once felt strong may weaken. Movements that once felt light may become slower. After the age of 60, this process, known as muscle loss, becomes more visible and can affect balance, posture, and even the quality of sleep. Yet the body still holds the ability to renew itself if we learn how to care for it with patience and awareness. Each night before I sleep, I take a few minutes to reconnect with my body, to give it what it needs to recover from the day. Gentle movement prepares the muscles for rest, improves circulation, and calms the mind. Tonight, I will guide you through 3 simple bedtime exercises that can help you prevent muscle loss and sleep more deeply. They do not require strength or equipment, only your attention and a willingness to move slowly. As you practice, remember, these moments are not about effort, but about presence. Let your breath be steady, your mind quiet, and your body will respond with gratitude. The first exercise is called the knee to chest stretch. It is a simple, gentle movement that supports the lower back, hips, and circulation before sleep. For many older adults, tension in the lower spine and hip area can cause discomfort or restlessness at night. This exercise helps release that tension and prepares the body for deeper rest. Scientific research supports its value. A study published in the Journal of Physical Therapy Science found that gentle hip and lower back stretches performed before bedtime improved sleep quality and reduced lower back stiffness in adults over 65. By lightly stretching these muscles, blood flow increases and pressure on the lumbar spine decreases. This promotes the release of endorphins, natural chemicals that reduce pain and encourage relaxation. Here is how you can practice it safely. 1. Lie comfortably on your back with both legs extended and your arms resting by your sides. 2. Slowly bend your right knee and bring it toward your chest. 3. Keep your shoulders relaxed and your gaze soft toward the ceiling. 4. Use one hand or whichever feels natural to gently support your thigh or shin. Do not pull or force the leg closer than it wishes to go. 5. Hold this position for about 20 to 30 seconds while breathing slowly through your nose. 6. Feel the stretch along your lower back and hip. Then gently release the leg and repeat on the other side. 7. Perform 2 or 3 rounds on each leg. Move slowly. If you feel sharp pain or dizziness, stop immediately. The goal is not to reach a limit, but to invite calmness into the body. You should feel a mild stretch, never strain or pressure in the joints. This simple motion improves flexibility and relieves compression in the spine, especially for those who spend much of the day sitting or standing. When done regularly, it can help reduce nighttime back discomfort and contribute to more stable balance during the day. As you complete this exercise, take a slow breath and allow your body to soften. Each movement is a small act of healing. A reminder that caring for the body is also a way of caring for the mind. The second exercise is known as the glute bridge. It is one of the most effective yet gentle movements to strengthen the lower body, especially the gluteal muscles, hamstrings, and core. These muscles play a key role in posture, balance, and walking stability, abilities that often decline with age. Weakness in the glutes and hips can increase the risk of falls, back pain, and overall fatigue. Strengthening them before bedtime helps maintain mobility and prevents the gradual muscle loss that comes naturally with aging. Scientific studies have shown how important this exercise can be for older adults. Research from the Journal of Aging and Physical Activity found that performing controlled glute bridges improved pelvic stability and reduced lower back strain in participants over 60. Another study in clinical interventions in aging suggested that activating the gluteal muscles increases growth hormone and testosterone production, both of which are essential for preserving muscle mass and bone strength in seniors. In other words, this simple movement helps the body stay strong and youthful even in later years. Here is how to perform it safely and effectively. 1. Lie on your back on a comfortable mat or bed. 2. Bend both knees so your feet are flat on the surface, hip width apart. Keep your arms relaxed alongside your body, palms facing down. 3. Take a deep breath in. As you exhale, gently press your heels into the floor and lift your hips upward. Your body should form a straight line from shoulders to knees. 4. Avoid arching your lower back. The power should come from tightening your glute muscles, not from pushing through your spine. 5. Hold the lifted position for about 3 to 5 seconds. Focus on engaging the glutes and keeping your core stable. 6. Slowly lower your hips back down to the mat while inhaling calmly. 7. Repeat this movement 10 to 15 times depending on your comfort and strength level. If you find it difficult to raise your hips high, that is perfectly fine. Start with smaller lifts and focus on maintaining control and balance. The goal is to activate the muscles gently, not to strain them. Over time, as your body adapts, you can gradually increase the height and duration of each hold. Safety notes: keep your neck relaxed and your gaze toward the ceiling. Avoid turning your head during the movement. If you have knee or hip replacements, consult your healthcare provider before starting. Stop immediately if you feel any pain or tingling in your lower back or legs. The glute bridge also offers a hidden benefit. It teaches your body to cooperate. The glutes, hamstrings, and lower back must work in harmony to lift and stabilize your frame. This coordination improves not only physical strength, but also awareness of how your body moves. As you finish the final repetitions, let your hips rest gently on the mat. Notice the warmth spreading across your lower body. That is circulation returning, energy moving freely again. In just a few minutes, you have reminded your muscles that they are alive, responsive, and capable. This quiet act of strength prepares you for rest, allowing both the body and mind to settle into a deep, healing sleep. The third exercise is called diaphragmatic breathing, also known as deep belly breathing. It may look simple, yet it has a profound impact on both the body and the mind. While the first two exercises focused on movement and strength, this final one helps the body recover, slow down, and enter a state of true rest. For older adults, mastering proper breathing can improve oxygen flow, reduce muscle tension, and promote better sleep quality, all essential for preserving vitality and calmness with age. Scientific research has consistently supported the benefits of diaphragmatic breathing. A study published in Frontiers in Psychology found that slow, deep breathing activates the parasympathetic nervous system, the part responsible for relaxation and repair. Another study from the Journal of Alternative and Complementary Medicine showed that practicing diaphragmatic breathing for 10 minutes before bedtime lowered cortisol levels, reduced blood pressure, and improved sleep duration in adults over 65. In simple terms, this technique helps the body shift from fight or flight to rest and restore. Here is how to practice it safely and effectively. 1. Find a comfortable position, either lying on your back or sitting upright with support behind you. 2. Place one hand gently on your chest and the other on your abdomen. 3. Inhale slowly through your nose. As you breathe in, feel the hand on your abdomen rise while the hand on your chest stays relatively still. This shows you are using your diaphragm rather than shallow chest breathing. 4. Hold the breath briefly, just a gentle pause of 1 or 2 seconds. 5. Exhale slowly through your mouth, letting the air flow out naturally as your abdomen softens and lowers. 6. Continue this cycle for 5 to 10 minutes, or as long as feels comfortable. Focus on making each breath slow, smooth, and even. During the exercise, avoid forcing the breath or tensing your shoulders. Let the rhythm develop naturally. You can close your eyes and imagine the breath as a gentle wave, moving in and out with ease. Safety notes: if you experience dizziness, shorten your breath slightly and rest. People with chronic lung disease or heart conditions should consult a doctor before beginning a new breathing routine. Practice in a quiet environment, free from distractions. Physiologically, diaphragmatic breathing increases oxygen exchange, stabilizes blood pressure, and enhances circulation to the muscles and brain. Psychologically, it reduces anxiety and restlessness, two common causes of poor sleep in older adults. Over time, this breathing habit can retrain your body to remain calm and balanced even during daily stress. As you lie quietly and breathe in this way, you may feel a subtle warmth spreading through your chest and belly. Each breath becomes an act of connection between body and mind, effort and rest. This is the moment when true recovery begins. The more you practice, the more natural it becomes. With each deep breath, you are teaching your body the language of peace, the final step towards strength, stillness, and restorative sleep. The best time to perform these exercises is about 1.5 to 2 hours after your last meal, when digestion has begun to settle and your body feels light again. Moving too soon after eating can strain the stomach, while waiting too long can cause stiffness or sluggish circulation. Allow your food to digest, take a short walk if you wish, then return to your quiet space. This is when your body is most ready to unwind. Ideally, practice these movements 30 to 40 minutes before bedtime. Lower the lights, silence distractions, and let this short routine become part of your nightly ritual. A transition from the busyness of the day to the stillness of rest. Follow the sequence in this order. Begin with the knee to chest stretch to gently loosen the hips and lower back, releasing tension that may have built up through the day. Then move into the glute bridge, activating the large muscles that support the spine and pelvis, improving blood flow and balance. Finish with diaphragmatic breathing, which calms the heart rate and signals to the brain that it is time to sleep. Each movement prepares the body for the next. Together, they form a complete cycle: stretch, strengthen, and soothe. When done regularly, this sequence not only protects your muscles, but also restores harmony between body and mind before the quiet hours of night. Now that you understand the rhythm of these movements and the right time to practice them, let us bring everything together into a quiet reflection, the closing of this nightly journey. These few minutes before sleep are not only about exercise, they are about returning to awareness, to the simple truth that caring for your body is an act of respect for life itself. As we age, our bodies ask for attention in softer voices. A slight ache, slower steps, restless nights, all gentle reminders that energy must be renewed, not forced. By performing these 3 simple exercises, you are giving your body what it truly needs: gentle motion, balanced strength, and calm breathing. Together, they prevent the silent process of muscle loss, improve circulation, and help the nervous system unwind so that you may fall asleep more easily and wake up with more vitality. Scientific research supports what many ancient traditions have always known. Movement before rest improves recovery during sleep. When the body relaxes, the brain releases growth hormone, the very substance that repairs muscle fibers and restores tissues. The breathing pattern you learned also lowers cortisol, the stress hormone that interferes with deep sleep. So even as you rest, your body continues to heal, rebuild, and renew itself. Think of this short routine not as a task, but as a ritual. Just as we prepare our mind for meditation or prayer, we can prepare the body for rest. Lower the lights, slow your breath, and enter this time with intention. You may notice that after several nights of practice, your muscles feel warmer, your joints more flexible, and your sleep more peaceful. This is the natural rhythm of recovery, a quiet conversation between body and mind. It does not matter how strong or flexible you once were. What matters is your willingness to stay present and to listen. Each movement, each breath is a message of care. Aging does not mean losing strength. It means learning how to use it wisely. Your body still carries great wisdom. It knows how to heal, how to adapt, how to find balance. All it needs is your cooperation. So tonight, when you finish the last breath of the routine, pause for a moment. Feel the stillness around you. Notice how your body has softened, how your heartbeat has slowed. Let this calmness flow through you as you lie down to sleep. Remember, the quality of your rest shapes the quality of your days. By nurturing yourself before bedtime, you build not only physical strength, but also emotional resilience and inner peace. With each night you practice, you teach your body that aging can be graceful, movement can be healing, and rest can be sacred. This is your time, a time to let go, to restore, and to remember that the most powerful medicine is mindfulness, expressed through simple movement and gentle breath.